Hi, my name is Dr. Albright. I'm an orthopedic surgeon at Advantage Orthopedic and Sports Medicine. I'm going to be talking to you about knee replacement. Arthritis happens to a lot of people as they age. Sometimes it's because of old injuries, other times it's genetics, sometimes it's your body shape or the types of activities that you've done throughout your lifetime. But essentially what happens is the cartilage starts to wear out in the knee and the bones become closer and closer together. And as you do that, you lose the smooth gliding surface, you start to get bone spurs, things get rough, they become painful, people get inflammation, and they start getting more and more pain. We have a lot of different ways to treat knee arthritis. Typically, we'll start with some activity modification, frequently weight loss. The first line of treatment is anti-inflammatory medications and Tylenol. After that, we may consider injections, either cortisone or viscosupplementation. If those things don't work and people are really starting to become limited with their activities of daily living, then we start thinking about knee replacement. So what a knee replacement is it's less of an actual replacement and it's more of a resurfacing. I didn't realize until recently that many of my patients really thought that what I would be doing in a knee replacement is physically cutting out the entire knee and putting in a new knee. But what we actually do is we use some cutting jigs, either customized or more off-the-shelf type jigs, to make extremely precise cuts. And essentially, what we're doing is we're just putting a shell on. So there's very little bone that's removed. We just reshape the ends of the bone so that you switch your bone-on-bone deformed knee into a metal and plastic knee. So that ultimately, when you're walking, you're just gliding on two smooth surfaces. And that's really what gives people pain relief. I tell most of my patients to expect a 3 to 6 month recovery. You can certainly be back to doing things much earlier than that, but I think it takes almost that long until I see what I call the happy face, where people really appreciate the fact that they're feeling better. By 6 weeks, most people can get back to work, function comfortably around the home and in the workplace, but they're still pretty sore. I think it's important to set reasonable expectations, and I find that that 3 to 6 month time frame really allows most people to get where they want to be. So there's been a lot of studies done about what you can do after you have a knee replacement. I let my patients do some light running activities. I mean, certainly occasional basketball. I have a few soccer coaches that play occasional soccer. I have a lot of skiers that go back to skiing. Horseback riding is allowed. Doubles tennis. Many of my patients are returning fairly quickly to pickleball. I have a lot of people going back to water sports. So I think you can do most things. Certainly this is not a surgery that's designed to get you back to running marathons. I think the expectations need to be reasonable. But I think if you treat your knee well, it can treat you well for a very long time.